There are some silent killer diseases widely acclaimed as the foremost cause of deaths in Nigeria and several parts of the African continent. These include hypertension and its allied ones such as heart failure. But another silent killer is on the rampage and has already infected more than 20 million Nigerians with the killer virus, hepatitis.
Viral hepatitis is very endemic in many parts of sub-Saharan Africa. We have viral hepatitis A, B, C, D, and E commonly occurring, and hepatitis A and hepatitis E are endemic in Nigeria. And I know that currently there is an epidemic of hepatitis E in the northeastern part of the country where there's insurgency.
Unfortunately, a staggering 95% of people infected with hepatitis B or C do not know they are infected, often living without symptoms for many years.
We see many of our patients come in late in the course of their illness. They are unaware of their hepatitis B or C status. They have never had access to screening. And even on coming to the hospitals, they have to pay for the services.
The mode of transmission, it could pass vertically from mother to child, and you can get it horizontally from a child to the fellow child, and then from an adult to adult. When you expose yourself in some risk behaviors.
An hepatitis virus is about 50 to 100 times more infectious than HIV. Despite this mind-boggling data, the disease has attracted very little attention from both the government and the people of Nigeria.
A lot of people don't even know that, that viral hepatitis exists, even within the healthcare professionals. Yes, knowledge gap is much.
There are 5 types of the virus: hepatitis A, B, C, D, and E, with hepatitis B potentially life-threatening. The cost of treatment, if any, is highly expensive.
Not all people infected by hepatitis B and C require treatment. So there's a clinical process whereby those infected are classified between those who really require treatment and those who don't. And also let me mention that hepatitis C is curable, while hepatitis B is not curable but controllable.
Hepatitis can be prevented by quality assured screening of all donated blood and blood components used for transfusion, safe injection practice, and safe sex practice. Halima Fashakin, AIT News, Abuja.